Hi, I'm Maree from Switch On Health, and today in this video, going to talk about Chamomilla, the homeopathic remedy, and some uses of it, mainly in acute conditions, but any remedy can be used in chronic as well. But I'll go through those key notes. Right, so chamomile has been used since ancient times by Egyptians, Greeks, and Romans to treat stomach issues, nervous tension, kidney or liver problems. By the 18th century, it was mainly recommended for digestive complaints and used as an inexpensive substitute for cinchona bark, often consumed as tea. Traditionally, chamomile root was also chewed to relieve toothache, and as you probably will be aware that or heard of, that chamomilla, the remedy, will often be used in children for dentition or even adults with pain. So the main affinities for chamomilla are mind, nerves, and emotions. So this is really key to kind of look at this and differentiate whether you need to use chamomilla or not. So the mucous membranes, digestion, liver, women and children, very much a children's remedy and a woman's remedy. Sexual organs, menses, labour pains, and left side. So it's a left-sided remedy. You may or may not be aware, but some or a lot of homeopathic remedies can be the right-sided or left-sided, or they can switch. But anyway, this is a left-sided remedy. Now, the peculiar or rare kind of symptoms of chamomilla is that the many complaints come after anger or being associated with anger. So they may have got angry about something and then a cough has developed, asthma has developed, some difficulties in respiration, uterine pain, inflammation, and metorrhagia. So the main indications for chamomilla is they're too ugly to live with, right? There is excessive irritability and anger is very obvious. They have an aversion to be spoken to and touched. So a baby might turn their head away. They don't want to be spoken to. They don't want to be touched. And there is this oversensitivity to and despair from the pain. So the pain is a lot and they can't deal with it. There's pain and heat, there's hot sweat, there's numbness, there's thirst. Coffee aggravates. Coffee is another drink that can aggravate the state and make it worse. And things can come on from coffee as well. Dentition aggravates, so they're really, really cranky. So that whole state has changed where normally they might be, quite normal and happy within kind of a normal range, and all of a sudden they're in a lot of pain and they're really cranky and they're irritable. Diarrhea is grass green, sort of spinach, it's hot, it's low in tentric, which is partially undigested food. Sour stool, it smells of spoiled eggs, so the stool doesn't smell good. And it can be at the beginning of or during the menses where they'll be really aggravated. So they'll be irritable and angry before or during their menses. So the emotional sphere is the most defining feature and frequently serves as a more reliable guide for remedy selection than general physical symptoms. Now, in saying that, I'm not saying don't use physical symptoms. Of course, you have to take that because we take a complete picture. But what will help you differentiate is the emotional and mental symptoms. So these key indications lies in that patient's mental state. So it's characterized again by irritability, impatience, extreme sensitivity to pain, and a tendency to complain constantly. So these are the key mental and emotional symptoms. Right, the person, the child, they're cross, they're ugly, they're uncivil, they're quarrelsome, they're vexed at every little trifle. Vexed being by they're irritated, they're frustrated, they really can't deal with anything. The child can throw tantrums. So there'll be a stiffening of that body. They'll bend backwards. They'll stamp their feet. They can kick. They can strike. They can throw things. You know, if you give them something and they throw it away at you or throw it away from something, they don't want it. They can bang their head on the floor, convulsions, and cyanosis from rage. So they're very angry. So this anger and vexation, which again is that irritability and frustration. There is a great oversensitivity to pain and external influences. So they can't bear the slightest pain, and external influences will be something like the wind. They don't want to be outside. The wind is really bothering them. They're going to be very oversensitive to any external influences. And that being, like, as I said before, touch. So just kind of look at those things when you're taking a case, just to see what the overreaction is. The child wants to be carried, right? They're only quiet when they're carried or rocked. Sometimes a child will refuse to walk and they have to be carried. So it's the little things like this where you can ask the mother or, you know, how are they? What are they doing? What are they doing differently to how they would normally behave? And so there's aversion to be spoken to or touched. And that's what I've said before. You know, the baby can turn their head. They don't want to know anything about it. Like even external influences can be music. They don't want to hear any music. That noise will really bother them. So the key physical symptoms, and these are really important too, if you see these. So they're hot and thirsty, or they've got a hot sweat with the pain. The hot feeling is without any objective heat. So it's being objective heat means that you know, it's not hot outside or it's not in a hot room. There is just this sensation of heat. There is swelling or redness of one cheek and paleness of the other. This is a key indicator for Chamomilla. If you do see that difference, their stools, as I said before, are hot. They're sour, grass green, they're slimy, yellowish green. They smell like spoiled eggs. Their sleep is disturbed by pain. So they will wake up and they won't be able to go back to sleep, or the pain will keep waking them. Now, foods, they can be aggravated by coffee and they want cold drinks, bread, sour food, vegetables. So even look for the changes in what they want as food. Normally, they might not want cold drinks. They're happy with anything, but all of a sudden they want cold drinks. So the drinks, they're better for coffee. That is a slight thing that sometimes happens, that in remedies, a remedy can aggravate, like coffee. Coffee can aggravate in a remedy, but it also can be better for ameliorated by coffee. So that happens with a lot of remedies. So just be mindful on that, that you can use both. Right, so the acute conditions, I'm just going to go through a few acute conditions. So with teething problems, pain is unbearable. The child is inconsolable, they're irritating, salivating, one red cheek, the other one is pale. They're worse from drinking and chewing, obviously chewing, and they don't want to know that causes pain. They don't want warm food. They can be worse at night, and that cold air, so that's that outside external thing that's going to bother them, and the external things like touch or pressure. Now you can compare, I've given a list of remedies here like Cena. Now Cena will also be very irritable and cross. So, you know, that's one you might want to consider. Then there might be a state where they're not at all angry or irritable, and it can possibly be pulsatilla. And they're not going to show those same angry, irritating behaviors. So this is where you might want to go and consider other remedies. So the child, also too, this is, you know, good for adults. Chamomilla is good for a toothache in adults. Colic in infants. right? So the child bends forward or draws the knees up. So ask the mother what they're doing, how they are behaving. Severe, unbearable pain. So that swelling of the abdomen, they're crying, they're wreathing, they're twisting, they just cannot be settled. The diarrhea, you look at the stool, and then they can have cold feet. Now, the mothers may not tell you they have cold feet, so just ask the mother those questions. And they might just feel the feet and go, oh, yeah, they are cold. So just those little things can make a really big difference. They're ameliorated by carrying and they're worse at night. So you want to compare, these are just remedies, right? Colosynthis, again, it is for those pains and are quite severe abdominal pains, the same with Magfos. If they arch backwards, you might want to consider Nux vomica. It again is irritable and angry, and same with belladonna. They will have slightly different indications. Belladonna is a thirstless remedy. They don't want to drink. They can be very flushed, glassy eyed. So there are a lot of other symptoms associated with different remedies. So this is where you need to compare whether it is a Chamomilla acute condition. Earaches. You can use it for earaches, stabbing, tearing pains in the ears, especially if they're on the left ear, inflammation of the media and meatus, especially in children, sensitive to open wind. So again, that external exposure of some sort. You might want to compare aconite or belladonna or Hepsulf or pulsatilla. Now, they all differ in their mental state. Belladonna will be angry. Pulsatilla is going to be sulky and crying and have a completely different kind of mental, emotional state. But they can still be in a lot of pain. So this is where you need to differentiate things. Now, the cough is dry, it's hard, it's irritating, and it's tickling in the throat. There are a lot of remedies for coughs. They're worse at night and it will again disturb their sleep. So they'll be waking with this cough. The cough will wake them. A cough that starts after being exposed to wind. So again, that external exposure, or after being angry or overexcited. So look to see whether there was anything that happened before. So it could be from ailments from anger, or they're angry and overexcited about something. So you can compare aconites, Drosera, ferrum phos. So I'm just putting these here for other indications for you to possibly have a look at later on. Now, if they're on a fever before noon, the fever will be with chilliness, and it will be after anger. There'll be the redness of the one cheek, the other one pale, and they'll be shuddering with heat. So if there's a sudden onset of fever, you might actually want to consider aconite or belladonna. And this where you can differentiate, where aconite suddenly becomes on, it can suddenly happen at midnight. They're extremely thirsty. They're hot, and the same with belladonna, except that belladonna again is thirstless, but they'll be red and hot and they'll be glassy eyed. So you look at these sort of smaller indications as to whether it really is chamomilla or it's better suited to another remedy. Then the steady onset of a fever, ferrum phos or gelsemium. And then others to consider would be Nux. And again, Nux is angry and irritable. Bryonia can be irritable as well. Except Bryonia will be very thirsty, very dry, and they don't want to move. Where you might be looking at arsenicum, where they're going to be restless, they're going to want to sip water, and they're going to be irritable as well. So these are just the differentiations that you need to make. So it's useful in labour, great in a labour kit, right? Because the rigidity of the OS during labour refers to a condition in which the cervix fails to dilate or dilates only really slowly. So this can cause a really prolonged labour and that can become really exhausted. So you can consider that. So Chamomilla can benefit particularly during labor when pain causes irritability. So the chamomilla kind of relaxes that and allows the labor to continue. Chamomilla can benefit particularly during labor when pain causes irritability, restlessness, or anger. So just look at the state of, a woman in labor and just see what the response is, and possibly with those indications during labour that chamomilla can be a good remedy to use. It helps to soothe emotional distress and physical discomfort, offering relief when the mother feels overwhelmed or unable to cope with the pain. So really important, I think, to have that in a labour first aid kit. So menses, right? So the pain is cramping before or during menses. This will be after anger, so it can be ailments from anger. And the pains will be labor-like pains. So there are other remedies with labor-like pains during the menses. So you need to sort of put that together. The flow is irregular, dark, and clotted. So it's a really valuable remedy for uterine hemorrhages. So what I'm going to do, these are key rubrics. So the rubrics, if you're not familiar, are symptoms, and they're put into a repertory, and the symptoms are called rubrics. So what I've done is that I've just given you a list of key symptoms that you could think about for, or key rubrics you can think about for chamomilla. So ailments from anger, or they're angry. So look at both. Now, capriciousness means that they want something, then they don't want it. They're really irritable. A child will demand something and you give it to them, and then they're going to throw it back at you or throw it away. They don't want it. They don't know what they want. They want to be carried, right? Even a toddler will refuse to walk and will want to be carried. So they're irritable, and so this is in infants, and the baby will be even maybe boring its head into the pillow. It's very restless, it's uncomfortable, it's irritable. You just can't do anything for the child. And of course, they will be irritable during dentition because that's pain and they're oversensitive to that. They want to rock. So when you're carrying them, they desire to be rocked. So that can be quite a kind of rocking motion when you're carrying them. They want that movement, and they're very sensitive to pain, and they're shrieking and crying and whinging and complaining with the pain, and they can't answer anything civil. They can't answer anything. They may refuse to answer, or if they answer, it's a snappish answer. Their extremities abducted, so they lie with their limbs abducted, which means that if you ask about a child's sleep position, they will say that they're maybe lying on their back and their legs are spread and their arms are out. So basically their limbs are away from the body. So sometimes that the sleep position can also to be a really good indicator as to whether you need to use chamomilla. So what I've done here is that I put the rubrics for chamomilla. So I've given a list, and it's kind of more like a reference for you, but just a few more remedies, but ones where chamomilla is highly recommended or highly indicated, but there are sometimes some other remedies, but not that many remedies. So that's what I've chosen. I mean, chamomilla can be, in a group of a symptom, and there can be 200 odd remedies. So what I've done is that I've just chosen these ones. So mind coffee aggravates. You can see that only there's chamomilla there and 6 other remedies you could possibly look at. And it's the same with that emotions for the respiration, which is difficult, and that can be with asthma or something like that. And there are only other 6 remedies. So impatience, right? So that goes with that irritability. They don't know what they want. They're shrieking. So there's only 7 remedies, but then in patient, there's only 3 other remedies. So mind weeping, so they're crying when they're being carried, and they can only be quieted and calmed when they're being carried. So there's chamomilla, and there's only one other remedy. I think that remedy is Cena. So they need that. So if the cheeks are hot and there's swelling, so this is where you're going to find this, under face in the repertory, there's swelling and then the cheeks are hot. Chamomilla is the only remedy. So it's really good to kind of see that swelling and see and feel that the cheeks are hot. The cough is dry and it's aggravated during the sleep. So there's only 9 other remedies, so 10 in total that you might want to consider. Respiration is difficult after suppressed measles. That's more likely to do with a chronic case, but there only are 2 other remedies. You might see that they have possibly had suppressed measles, and there are behavioural issues, things like that, because chamomilla can be used for children with behavioural issues. The stomach, the coffee aggravates. 6 other remedies. Indigestion, as we can see, it is related to the digestive system. 2 other remedies. Thirst, so they're thirsty during their pain, so it's 5. Vomiting with anger. Okay, so that's one that's really good to consider as well. So it's very important to take these symptoms. Menorrhagia, so after anger, right? So this is for 3 remedies. Female, labor pains running upwards, then you're going to look at chamomilla, and there's possibly 4 other remedies. But of course, if you've got labor pains running upward, and then you've also, have impatience or irritability or anger, then that could be good one. And I did speak about labor pains before. There can be complaints after anger in the uterus, so it'll be painful. Chamomilla is the only remedy for that one. Female uterus, they're angry and after, so cramping, and they're after, so the uterus, so after cramping, after anger, there's cramping, it's after anger and the uterus there, and they've got uterine pain, then chamomilla is the only remedy. Extremities, their feet, they want to uncover their feet. So there are 4 other remedies. So that heat is really aggravating for them. Okay, so that just gives you an idea of um, how you can consider chamomilla as a remedy for basically acute conditions, but do remember that any homeopathic remedy can be used chronically as well, but chamomilla is one that's often used acutely. So learn more with Switch on Health, and I hope you all have a lovely day or evening.